For over 50 years, Boulder Center for Orthopedics and Spine has been serving patients in Boulder, Broomfield, and the entire Front Range. As the region's most preferred orthopedic practice, they offer the latest in joint replacement and revision techniques in their state-of-the-art facilities. Their doctors are highly trained specialists focusing on and dedicated to delivering orthopedic excellence. We recently took a trip to their Broomfield location, so take a look.
You are a doctor of osteopathic medicine. Can you explain what that means and how maybe your approach might be different than a traditional doctor?
Yeah, so when we study osteopathic medicine, we study more of a holistic approach. So we kind of look at the patient, not only their physical ailments, but their kind of social structure, their goals, to create a holistic approach to their treatment. Basically, we kind of involve all those aspects into their treatment plan. So I kind of look at the whole picture, not just what's causing an issue.
Okay. What types of patients or conditions do you typically treat here at Boulder Center?
So I do all non-surgical orthopedics. So I see anyone from 12 years old to my oldest patient is 106. And I see patients with a variety of musculoskeletal complaints. So any knee pain, shoulder pain, a lot of back and neck pain, a lot of nerve issues. I kind of see a hodgepodge of things.
And are there any high-tech tools that you use, and how can those help really diagnose what a patient might be going through?
Yeah. So two things I do a lot of is EMG and nerve conduction studies. And that helps me differentiate whether their nerve pain in their arm is from their neck or their carpal tunnel or their cubital tunnel. And then I also use a lot of ultrasound. Ultrasound is an image guidance. I use that for diagnosis of tendon issues, also with procedural skills, so like guiding a needle to an area.
But you also offer a lot of non-surgical treatments. And so how can those types of treatments help a patient avoid surgery?
Yeah. So we can do a lot of things before surgery. So a lot of injections I do, steroids, sometimes regenerative medicine with PRP. We put those into the areas to allow healing so you don't have to surgically get a replacement or repair.
And you've trained a lot of places from Virginia Beach to Kentucky. And so what brought you here to Colorado?
Oh, I love Colorado. I grew up here a little bit when I was younger. My dad was military. I'm a big trail runner. I love skiing. So it's really the perfect place.
Well, and being active yourself, you know how important movement really is. Mm-hmm. How does that kind of connect you and help you with your connection with your patients?
Yeah, I think movement is medicine. And so, getting people going back to doing what they love to do, whether that's walking, riding their bike, anywhere from, my patients who love to just go sightseeing and birds in the mountains to my higher level athletes who do triathlons. I really like seeing patients get back to where they were before their injury.
How do you see your role in helping Coloradans to stay moving and to stay healthy here?
Yeah. So I think, the patient-doctor relationship is crucial in that because a lot of patients want to be active and want to be able to do their things, and they're nervous when they have an injury. So really guiding that process of, hey, it's okay to take this next step and go back, or, hey, no, we need to take a break. But ultimately, just having that relationship between the patient and the doctor to guide the treatment back to their activity is kind of what I expect.
And talk to us about this office location here in Broomfield. What does this offer to patients?
So we are outside of Boulder. So we're kind of in a middle spot between Erie, Lafayette, Broomfield, Thornton. It's a great location for our patients who are a little bit more east, and, who don't always want to travel into Boulder for some of the traffic sometimes. But our location, it has a full clinic, full surgery center, and we offer it to all the surrounding neighborhoods.
To learn more about Dr. Slater and her specialties, visit bouldercenter.com. That's also where you can find details about the orthopedic care services provided, like Mako Smart Robotics Technology, MRI scans, orthobiologic injections, physical therapy practices, and more. Visit one of their Front Range locations in either Boulder or Broomfield, and to schedule an appointment, call 303-449-2730. Boulder Center paid for this segment.